worst case scenario that can happen with Botox? People always ask me what is the worst case scenario, and I get that question a lot, whether I'm working in the hospital, whether I'm doing injectables. Everyone wants to know what's the worst case scenario when they're starting new medication or they're getting an injectable. With Botox, the worst case scenario that I worry about as an injector is I worry that somebody might press the Botox from the area that we injected it into an area that we don't want. So what does that look like? Usually when we inject Botox, we're putting it into muscles in very specific areas to do very specific things to relax that muscle. And if someone were to lay face down or press on the area or wear a tight-fitting hat after injection, they might press the Botox and move the Botox into a different muscle, specifically the palpebral muscle or your upper eyelid muscle is what I worry about the most, and that could cause an eyelid ptosis or a drooping eyelid. So that's why I'm really strict in my post-care instructions, because we can actually avoid that entirely if someone makes sure not to lay face down, not to press on the area, not to wear a tight-fitting hat, and not to exercise, specifically 4 hours after injection, not to press on the area, and not to work out for 24 hours after injection. Technically, you can get an eyelid ptosis if you go to an injector who injects the Botox directly into that muscle and it's going into the incorrect area. I've never seen it in person from actual injection, but I have seen somebody press on the area and move the Botox and slightly cause a mild ptosis, and there are medications we can prescribe and techniques we can do to help counteract that. But if we're looking at worst case scenario, it's nice that Botox is otherwise a localized injection and it's not found systemically. So the worst case scenario is something that is preventable, and it's also something that's temporary, something that will wear off, and it's also something that happens in less than 1% of the cases. So overall, it's a very safe injection so long as we're following our post-care instructions and you're going to a reputable injector.